we see so many senior people who it's difficult even to start the helping process because they don't have the support in terms of even providing the food for them that they need to eat. And then there are some who you can see that they're on a road to, because they get so much love, so much support. So there are a number of factors to consider. So let's look at treatment plan. As I said, I'm not going to go much into this. A cancer treatment plan is a detailed outline of a patient's cancer treatment, including the patient's disease information, the treatment goals, the treatment options, possible side effects, and the expected treatment length. So when you go to your doctor, what you want to find out from them is what is going to be my treatment plan. And that's how you know when the person is giving you the runaround. Because once you have cancer, you become fearful and you become desperate. And say, drowning man, hold on to straw. And some people, this week, they go see that person, then get this herb, that week they got this. No, that's not, it's not going to help you. There are some people who are like mad ants and run all over the place and run around the place. So I said to you, you want to know, once you hear that you have cancer, you hear that a loved one has cancer, the first thing that you want to know is what family does this cancer belong to? Number one. Number two, what stage is the cancer? And then finally, number three, what is going to be the treatment plan? So within that treatment plan, your healthcare provider is supposed to talk to you about reasonable expectation. You don't expect to take something and then 1 month after you get healed. So people are ridiculous and ludicrous. Somebody tells you that all you need to do is to drink this, take this pill, or drink this herb, and you get better. They're taking advantage of your desperation. Miss B says, my family medical history, pancreatic cancer stage 4, kidney failure, heart attacks, and blindness. So this may be your family history, Miss B, but it doesn't mean that it have to be your reality. It just means that because you belong to that family, there's a high incidence or a high likelihood. Doesn't mean that it's definitely the path that you're going to go down. It just means that there's a higher likelihood. And so because you are from that family and you share certain common relationships, this just might be a common relationship that you share. Doesn't mean that you have to have it. Right? So again, let me go through them again. So the minute you hear that you have cancer or somebody has cancer, the first thing that you want to do is, let me see if everybody's paying attention. I see some people just joining. What is the first thing you want to do? I want you to put it on the chat. We're finishing up now. And I want to know that I have said enough to help you. What's the first thing you need to know? The first thing that you need to know when you hear somebody has cancer, what's the first thing? The family. What family is this cancer from? Which family does it belong to? The second thing you need to know, what stage it is, how advanced it is, how much time do I have? And the last thing that you need to know, what's the last thing you need to know? Third thing you need to know. What's the third thing you need to know? The stage is the second thing. What's the third thing you need to know? This is what your healthcare provider, what are the treatment options? So doctor, I now know what family my cancer belongs to. I now know what stage it is at. That's what they're supposed to inform you and educate you about. So the next thing you need to know, the third thing you need to know is, what are my treatment options? And why are these my treatment options? Are you with me? What are my treatment options and why? Because what happens now is you're in the know, you're also in the driving seat. and you're relying with them, you're relying on them. And so now, based on what you're hearing, you have common sense, because you may not be a doctor, but you have what is called common sense. If what they're saying to you don't add up, it don't add up. If what they're saying to you don't add up, guess what happens? It don't add up. You may not go to school, but guess what? You have common sense. Why is it that you're recommending a surgery for stage 4 leukemia? How is that going to help me? And sometimes one of the things that they do is that they recommend all these tests. Sometimes the tests are necessary because what the doctor wants to know is what they're trying to identify, especially, we didn't go into the what is called the where the cancer is located. And sometimes that is important, especially for cancers of the colon. Because sometimes the doctor, you may have obstruction, and the doctor wants to see, they want to know you're having bleeding, they want to know what's happening. Sometimes even persons, even if you're using a natural approach, that person still wants to know because they want to know how to approach it. So that's very important for you to know. A patient treatment plan is determined by a number of factors, including the type and stage of the cancer, as well as the patient's preferences and those of their healthcare team. Some patients may undergo a single treatment, while others may require a combination of treatments. And I want you to know that many times you have to evaluate. The goal is for you to evaluate how good of a team you have to, because if you have a team and they don't factor what you think or what you believe or your preference, you've got to really think about the team that you have. Because for me, the first sign of respect for me is what I think. Now, I know that the job of your healthcare provider is to inform and to educate, and some of you may hold on to very ludicrous, uninformed positions, but then the job of your healthcare provider is to educate you. If after they have educated you and you still hold to those opinions, then they still must be respected. So, for example, if you are a believer and your belief is that I will not take blood into my body, as your healthcare provider, I may deem this as being necessary, and I may also not agree with your stance and your position. But agreeing and respecting are two different things. I must respect your stance and your position. I must do my best to ensure that I explain to you the risk, that I explain to you the benefits. But after doing my best and after being fully aware that you understand the risk and the benefits and you hold to a particular decision, my goal is to respect that. And so a lot of people don't know that their health is their responsibility. One of the reasons why our healthcare system is the way it is because our medical system has led persons to believe that they are responsible for your health. And they are not. They have the ability and they have the mandate to guide you and to inform you. But they are not responsible for it. Let me quickly just talk about, because I have to do this, talk about my treatment plan and options. So surgery is one of them, an operation to remove the cancer as much as is possible. So sometimes the surgery is not to remove it. The surgery sometimes is to remove enough of it to buy you more time. Chemotherapy, I have to mention it. I don't necessarily agree with it, but I have to mention it because it is an option. the use of strong medicines to kill or shrink the cancer. Now, don't go and say Dr. Ben is telling persons to do chemotherapy. I'm mentioning it because it is an option. So it has to be mentioned. And maybe justified at times. Because it's not justified at chemotherapy, it's the amount. And there are a number of factors to consider. I'm not telling you to do it, but I'm just saying, be informed. Don't just close your mind. Listen to what your healthcare provider is saying. Become informed. Then make an informed decision. Radiation therapy, the use of high energy rays, such as X-rays or protons to kill the cancer. That's an option. Then there's hormonal therapy, a treatment that prevents cancer cells from getting the hormones they need in order to grow. These are some of the options that are out there. And I have some other options. Let me talk about these options too. Immunotherapy, a treatment that uses medicine to help the body's immune system to fight cancer cells. These are some of the therapies that have been developed over the years because of how cancers are constantly evolving. They have had to come up because remember I said, apart from the 5 that we've talked about, there are over 200 different types. We just spoke about the 5 major families. Then there's stem cell transplant, a procedure that replaces bone marrow cells that have been damaged by chemotherapy or radiation therapy. Now, those are some of the options that are out there, and there are other natural options. I've not included those natural options tonight because I promise you that I won't go into them. But I'm planning a webinar for next week, Sunday at 7 p.m. So I'm not going to be on. I'm going to be having a private webinar